We looked into research about COVID-19 mandates and policies and with the masks and the vaccines in Connecticut in schools. And we have found that schools decided recently, pretty much last month, that they're going to be optional for mask and vaccination policies because they think that there's no need to have weekly tests anymore and we don't need to wear masks unless we want to. So that's becoming an optional thing. And that started on February 28th for the masks and then February 15th for vaccinations and weekly renewals.
Yeah, so it was like really interesting because a lot of the vaccination policies in different states are like kind of similar. It has to do with like federal contractors or like employees that are employers that have a lot of employees and just businesses that are huge. And then like also like medical people and emergency response people usually need some sort of vaccination or medical exemption, which is good. But 27 states in the US actually have these policies, and then 24 do not. And then we go into the idea of mandates and whether those are like actually a thing in all of these states or whether they aren't. And then we learned that there are like prohibited ones, which was interesting because I never thought like these mandates would be prohibited in some of the states because it should be like a personal choice. But in my opinion, I think it should be a personal choice. But places like Florida and like 12 other states included all have these, like they're prohibiting actually having state mandates. And then it's like local governments and they don't need to actually provide documentation of vaccination to go in any of these facilities. Same thing with schools and any educational institute. Also, just the students and faculty don't need to provide COVID-19 vaccination documentation, which is really interesting because that just takes away like a whole layer of safety if it's prohibited versus like actually requiring it like 23 other states. But yeah, all different states have different mandates, which is, you know, some are more restrictive, some are more relaxed and like politically based, like government positions, or even just being like healthcare based versus education based. And I think it should be up to like your choice. I don't think any state should actually like make it so that you have to require these if it's your business. So I was surprised when I actually saw that data when doing the research.
Yeah, I agree with that because I feel like it's like we interviewed a few people about the comfort level of being around other people, whether they're wearing masks or not, and if not knowing if they're vaccinated or not, since it's not a requirement now. And those interviews will be coming up a little bit later in this conversation. But I think it's like not really optimal to not require masks or vaccines because I think it creates this kind of like iffy environment where you don't really know if other people are vaccinated or masking, and you don't, it's like a touchy topic to like bring up, so you kind of want to like avoid doing that to prevent like your friendships from falling apart if you guys have like disagreeing opinions or if you guys get into an argument. And I think, but like it's about health, so it's kind of important to be able to voice those opinions, and there's some places where that is not like accepted, and like I think banning mandates is honestly not the best move because there are going to be people who either really do or don't want to mask and know everyone around them is vaccinated or supposed to be vaccinated. And I think that layer of safety of knowing that it's like a requirement or at least optional is a really big thing. And I think that personally in Hopkins, if they banned the ability to be wearing masks or banned any like mandates or whatsoever, I think that a lot of people would stick to being virtual again because most of the people that would come to school are the people that didn't want masks in the first place and don't really like are a bit nonchalant about COVID. And some of the people that would be staying home are the people that have like parents who don't want them going, or they don't want to go for health sakes, and it's like you can't see your friends and you can't learn the same through the hybrid method, because everyone was voicing opinions about Zoom, and I know that wasn't like great for a lot of people. So I feel like it's just like the ability to have an option is like really critical in the environment that we have today.
Yeah. And if you think about like residents who also have these, elderly family or immunocompromised like family members, like they don't even get to choose to require their stuff in their own businesses, which I just feel like it's very restricting. Like you said with Hopkins, if they decide to like forbid having like masks, or like if they never actually like made it mandatory to have these vaccination records, I probably wouldn't feel comfortable. Like I get it for here, I'm a little uncomfortable usually being like in the space with so many people not wearing masks, but at least I know that I can keep mine on, which gives me like a level of security. But I feel like in states that have these places that it's like not required to do any of that, I don't know if like I would feel comfortable even going out in like those type of environments, like not knowing what's actually around me and like how safe I am in like regard to COVID.
Yeah, me too.
Especially since like because we know, so through our research, like we know that the cases and the new cases have like gone down. It used to be like over 1 million new cases at the start of January. There were like 1 million new cases reported, and now it's around like 5,000-ish new cases of COVID-19 in the US alone as of like April 3rd. So it's definitely gone down a lot, but at the same time, like those are 5,000 new cases. So it's like this sense of like, okay, there isn't that immediacy of like need for quarantine and masks and social distancing, but it's still there, and it's still like something that is in our environment and can affect us.
Definitely, I agree.
But yeah, here are some interviews that we wanted like a Hopkins voice out of this. So we chose 4 people to interview, including some faculty members, people of different grades and all that. And we hope to kind of just like get the voice of Hopkins. So we have a couple questions. The first one is, what are your opinions on Hopkins lifting the mask mandate?
I'm fine with them lifting the mask mandate, but I'm gonna keep wearing mine.
Okay. Do you feel safe and comfortable with people not wearing their masks around campus?
Yes, I do.
Okay. Do you still wear your mask going to like public places outside of school, whether it's grocery store, movie theaters?
Yeah, I wear my mask everywhere.
Okay. Would you feel safe and comfortable going into crowded places such as concerts or the subway?
It depends on the context and what would be required. Like if it, let's say it was for the subway, that's different than going to a concert because that's more required and necessary. So.
Would you continue to like wear your mask in crowded places like that?
Probably, yes.
Did wearing masks affect like your academic life or like interfering with your day-to-day, whether that's like in class or just like projecting wise or focus wise?
I mean, the mask, they don't really bother me. The only slightly annoying thing would be wearing a mask with glasses on, but it doesn't really matter that much.
Okay, thank you.
Thank you.
So the first question is, what are your opinions on Hopkins lifting the mask mandate?
I think that lifting the mask mandate is appropriate in this regard because it offers people an opportunity to kind of experience the sense of community that we had before masking 2 years ago. The thing I like best about it though is that it's optional, right? So that you can continue to wear your mask and feel comfortable to the extent that you wish to. And from my experience so far, it seems like both faculty and students who are not comfortable feel, I think, hopefully, fingers crossed, feel happy and like comfortable with the choices that they've made. And I don't know what your experience may have been like thus far, but I haven't personally heard of anybody like teasing people who choose to wear masks or not for that matter. So I think that in general, it's good for community building.
Do you feel safe and comfortable with people not wearing masks on campus?
I personally do. I am triply vaccinated, and I do not feel any sense of discomfort being at school without masks.
How do your opinions on the immediacy of COVID-19's concerns compared to like the beginning of quarantine?
I think considerably less. Though I am not an expert in infectious diseases, it would seem as though with vaccination and with the ways in which the virus is mutating, that symptoms are generally coming in milder for people who contract COVID-19. So on the whole, I would say that my personal concerns and the concerns of my family and our community are significantly less now than they were in March of 2020 or April of 2020.
Do you wear masks when going to public spaces outside of schools, like the grocery store, malls, movie theaters, stuff like that?
I no longer wear my mask
Okay.
unless a business establishment requires me to.
And then how did wearing masks affect your academic life? Did it like interfere with your day-to-day life or anything like that?
No, I mean, I only since spring break, partially in an attempt to prepare myself for the idea that we were going to be coming into a maskless environment. That's when I sort of was like, all right, I'm just going to see how I feel doing this, meaning with my life without a mask. And I never really found it distracting from the classroom perspective. I can project my voice and be loud, like if I need to. I actually found it more distracting because there's a lot of students who I think, especially students that like don't want to project their voice in general, it made those students that much harder to hear. I mean, I think it was harder for classmates. I mean, nothing would compare to, I would rather be in the class masked than on Zoom, which was almost impossible to mutually understand each other and actually facilitate useful conversations. But no, I didn't find masking to be a pedagogical or educational hurdle to overcome.
Do you have any other comments? About like COVID-19 mandates or just mask policies in general, whether it's Connecticut, US based, Florida based, Hopkins based?
Yeah, I mean, I would hope that people would continue to trust scientists and doctors. It seems like I've felt certainly empowered by having people sort of feed me what expert opinions are, and knock on wood, I'm 2 years in and I haven't had any strain of COVID. So I've been, quite careful following the advice that was handed on to me, and the most recent advice has been that if I'm comfortable with it, I can remove my mask. And I think 2 years in, and trying to grow a beard, it's been nice to be maskless, and I continue to feel happy with my decisions, and I hope that other people do as well.
Great, thank you.
Thank you.
Okay, so we have a couple of questions. One would be like, what are your opinions on Hopkins lifting the mask mandate? And like, do you feel safe and comfortable with people not wearing masks on campus?
Okay. Personally, I feel more comfortable wearing a mask just because I have immunocompromised grandparents that I live with. But I think if you're vaccinated and it's like there's reasonable space between everyone, I think you can take off the mask now, especially since like cases are getting fewer.
Okay. Do you wear your mask when going to like public places outside of school, like grocery stores, movie theaters, stuff like that?
Yeah, I pretty much wear my mask everywhere unless I'm eating or I'm in like a very open space. Typically.
How do your like opinions on the immediacy of like COVID-19 concerns compared to when it was the beginning of quarantine?
I feel like having most people at Hopkins be vaccinated, it's like eased my concerns a little. And I'm not as anxious as I was before about it. But I feel like there's always a chance of another like new virus or like it reoccurring. So I feel like we can never really be careful.
Would you feel safe and comfortable going into crowded public places such as like concerts or the subway?
Not really, honestly. I feel like there's still like a high chance of, especially like in the subway, of like people who like aren't really taking the necessary precautions to keep themselves and others safe.
Thank you. That's all the questions.
Wonderful.
That was great. Thank you for everyone who interviewed with us and spent the time to actually help us out with our senior project. This will kind of like conclude, I guess, topic 1 about COVID-19, and we look forward to next week.
Stay safe, everybody.